It's my great pleasure to introduce our final speaker for this evening, Lord Howe, Parliamentary Under-Secretary of State at the Department of Health. Thank you.
Thank you very much indeed. I'm delighted to be with you all tonight and welcome this opportunity to round up these very stimulating proceedings. This conference is very much about the future and looking forward, but it's often instructive, I think, when looking at the future to put our ambitions and aspirations into the context of what has gone before. The 20th century, looking back on it, saw a remarkable output of life-saving and enhancing medical achievements and inventions. Take the structure of DNA discovered by Watson and Crick in Cambridge, an achievement being built on today at the world-leading Sanger Institute and quite soon at the Francis Crick Institute, which is rising from a hole in the ground just down the road from us. Or the classic example of penicillin, discovered by Sir Alexander Fleming in 1928 in a small laboratory in St Mary's Hospital, and first used to cure patients in Sheffield before going on to change lives around the world. Britain produced the first test tube baby in 1978, and now 6,000 are born in the UK annually, and women worldwide have benefited from that procedure. Or the MRI scanner, which a British scientist helped to invent. A British company made the first commercial product, and now a factory in the Prime Minister's constituency, Witney, is a leading producer of scanning magnets. We are a country that since 1903 has produced 100 Nobel Prize winners. Most recently, Sir John Bertrand Gurdon, a British scientist, jointly with Shinya Yamanaka from Japan, were awarded the prize for changing adult cells into stem cells. This is groundbreaking science, which will undoubtedly transform future treatments. So the UK has a remarkable history which we can be proud of, built on our science base, our skills, our NHS, and our industry. And I underline that point in order to impress upon you the government's clear ambition, namely that what we have achieved in the 20th century, we want to emulate and surpass in the 21st. We are determined to do whatever is necessary to enable world-class scientific advances to continue to be made in the UK. We want companies to research and develop drugs and new technologies and diagnostics that will not only benefit patients in the UK, but also patients worldwide. But it isn't just science and research where we are strong. We've always been a leader in healthcare provision as well. The NHS is part of our national heritage, as we saw from the Olympics opening ceremony, but the NHS is not perfect, and like many other health systems, it is facing a tougher financial climate than it has ever experienced previously. And that means simply doing more of the same is no longer an option. Now more than ever, innovation has a vital role to play in delivering high quality care and value for money, while at the same time driving economic growth. One of our prime objectives is therefore to improve the health of the nation, and to accomplish that, we are undertaking a full modernisation of the National Health Service. What does modernisation mean? It means empowering and informing patients. It means freedom for clinicians to organise NHS services as they see fit, replacing traditional central control and top-down management from Whitehall. It means that instead of concentrating on process and targets and inputs, there will be a resolute focus on what really matters the most, health outcomes and the quality of the care that's delivered. And it also means stripping out layers of bureaucracy to simplify the structure of the NHS, improving efficiency and making the NHS both sustainable and self-improving. At the same time, we are clear that the focus on improving outcomes should not be at the expense of the NHS's founding principles, most importantly, that health services should remain free of charge, except, of course, where charges are specifically provided for by law. An independent but accountable NHS Commissioning Board is a key component of these arrangements. It needs to be independent if we are to distance politicians from the day-to-day delivery of healthcare, and to have a health service that is clinically led. Clinical leadership and devolving power downwards to clinicians and professionals at local level are perhaps the key element of the reforms. The Health and Social Care Act 2012 set out the alterations to the NHS needed to deliver the new commissioning architecture. And that architecture devolves responsibility for most commissioning to local commissioning groups, CCGs, supported and held to account by an independent NHS Commissioning Board. And these bodies will collectively take on many of the roles and responsibilities currently discharged by the Department of Health, strategic health authorities, primary care trusts, and so on. But the end result will be a system that is led by health professionals rather than by managers. Decisions on how best to deliver healthcare to meet the needs of patients will be taken by one and the same group of people who have direct responsibility for the disposal of the commissioning budget. The NHS Commissioning Board will have an overarching responsibility for promoting a comprehensive health service, a health service explicitly designed in the legislation to secure improvements in the physical and mental health of the people of England and in the prevention, diagnosis and treatment of physical and mental illness. At the same time, it has a duty to hold commissioners in CCGs to account for the health outcomes that they deliver. And the legal duties that run alongside that are absolutely central to the topics that you're examining this evening. A duty to promote continuous improvement in the quality of healthcare, a duty to integrate services, a duty to promote innovation, a duty to promote research. These duties, which the board and CCGs will be held to account to deliver, are absolutely key to the reforms. And that's why I believe that as the NHS tries to find more efficient and innovative ways to meet demand, there will be a really fertile environment for the life sciences industry in this country. The life sciences industry has played a central role in improving the quality of life for millions of people since the creation of the NHS, and it has been one of the UK economy's most extraordinary success stories. The UK government already enjoys strong and productive relationships with all parts of the life sciences industry, and we do all we can to foster similarly strong relationships between the industry and the NHS. The government is pro-business. We want to encourage more investment in innovation and life sciences, and our aim is for this country to be the first choice for life sciences investment, and as such, a strong base from which to export. We want companies to continue to develop new drugs and technologies that will bring significant benefits to patients. But we also recognise that this needs to be balanced against ensuring value for money for the NHS and for taxpayers. All of us are familiar with the current impact of the global economic situation, and the UK government response has been to map out a path towards a new model of economic growth. If we are to remain competitive, we've got to raise our game in the UK. We must use our world-class science base to its fullest potential and be at the forefront of life sciences in the new landscape. Maximising our competitive strength in the life sciences depends on our ability to bring together our research base in all its manifestations and the NHS. Hence, the government's strategy for UK life sciences, which sets out a bold vision for the UK over the next 10 to 15 years. The vision in the strategy is to unlock our strengths: excellence in research and development, a leading health system, leading universities, and vibrant investors and industry. And bringing those elements together is what will drive innovation. And the fruits of that collaboration will be A, improved patient care, and B, economic growth. If we get the formula right, and we have all the ingredients to do so, the UK will become a global hub for life sciences in the future, providing an unrivaled ecosystem that brings together business, researchers, clinicians, and patients to translate discovery into clinical use for patients within the NHS. The clear aim is for the UK to provide an environment and an infrastructure that supports researchers and clinicians to bring innovation to market earlier and more easily. Now, this is a long-term strategy, but 10 months on from the launch, we can already point to some important progress. The Prime Minister and my colleague in BIS, David Willits, launched the TSB MRC Biomedical Catalyst Fund in April, £180 million to help an idea bridge the gap between a concept and its commercialization, the so-called valley of death. Funds are available to UK businesses and academics looking to develop innovative solutions to healthcare challenges, either individually or in collaboration. The Clinical Practice Research Data Link was launched in March. This is a £60 million investment by the National Institute for Health Research and the MHRA. And it provides researchers with access to patient data for clinical trials recruitment and observational studies, a facility unique in the world, a genuine USP for this country. We've created the Health Research Authority to streamline the often tortuous approvals process for clinical trials. We've launched the updated UK Clinical Trials Gateway, which enables the public and patients to have internet access to information about clinical trials in the UK that may be relevant to them. The UK Strategy for Regenerative Medicine was published in March, and the Regenerative Medicine Funding Scheme, known as the UK Regenerative Medicine Platform, is open for calls to fund research hubs. The MHRA's consultation on an early access scheme for promising new medicines was launched in July. And looking more generally at incentives of a fiscal nature, for the first time, we're creating a patent box. The patent box means that if a company creates intellectual property in the UK, it will pay a corporation tax rate of just 10% on any profits, including profits earned overseas, generated by those patents. Now, investment in research and development is key to the growth strategy, but the uptake of innovative technology is a separately and equally key issue. It's an issue that the NHS has wrestled with for years. So to complement the work of the strategy, the Department of Health launched what we called Innovation, Health and Wealth in December last year. And this is a program that sets out an agenda for spreading innovation at pace and at scale through the NHS. It's a long-term program that includes 31 recommendations which are being taken forward by separate task and finish groups with the close involvement of industry. So far, we've delivered 14 of the 31 recommendations that we committed to deliver in the 18-month time frame. For example, uptake of new drugs. We're determined to dismantle the barriers that have persistently prevented uptake of NICE-approved medicines at a local level. And we will do that by forcing commissioners and providers to publish their prescribing data and benchmark them against each other. This is the comply or explain regime, and it will serve to flush out those areas of the country where local formularies are failing to keep pace with recommended technologies. Procurement. For years, an intractable problem across the NHS, but we're driving forward work to achieve best value in procurement, not just for pure financial reasons, but also to ensure that procurement practice can respond quickly to innovation in medtech. The key to this will be greater transparency of data and a more mature relationship between the NHS and industry. Part of this is basically making the NHS into a more intelligent customer. We've doubled the investment in the Small Business Research Initiative, which is an initiative aimed primarily at SMEs as a means of delivering innovative products and services to NHS patients. The 3 Million Lives Initiative is about delivering telehealth and telecare to 3 million people in their own homes, the largest such project anywhere in the world. And in my judgment, a hugely significant initiative. We're creating academic health science networks. The aim of AHSNs is to align new ideas, informatics, training, and healthcare delivery in a way that will accelerate real-world experience across the health service of innovative new techniques and technologies. Now, the beneficiaries of this will undoubtedly be the life sciences sector of our economy, but also the NHS and its patients. And I'll just end by talking about all this from a healthcare perspective. Through all of this, I think we can get a glimpse of the NHS as it will operate in the future. A service that is responsive to clinical leaders who want to innovate and follow best practice, with tariffs to support those decisions. A service in which results are measured and are transparent. A world where health priorities and service configuration are determined locally by health professionals working hand in glove with local authorities and patients. A service that increasingly focuses on prevention and that delivers care outside the hospital setting, i.e. at home, where most patients would prefer to be. A service that is delivered much more efficiently and effectively by being integrated with other services, notably social care, and one where personalised care and the patient experience are seen as key markers of what good quality care looks like. Indeed, all of this is about nothing unless it is about the patient. What it means is that the NHS needs to be held to account in new ways by reference to the patient and the results achieved for the patient. I hope and believe that we have embarked upon one of the most exciting journeys that healthcare in this country has seen throughout the 60-year history of the NHS. And that journey requires all of us to work together to common objectives, from the GP practicing in his surgery, to the surgeon in hospital, to the midwife operating in the community, through commissioners, providers, regulators, and indeed the Department of Health itself. It is a supremely worthwhile endeavour, and one on which we must, absolutely must, succeed. Thank you very much.